All right, let's unpack this. Imagine a world where mental health isn't just, a personal struggle, but really a global challenge. We're talking huge numbers, like 615 million people grappling with depression or anxiety.
Hmm.
It's this massive burden, right, on individuals, families, society. And into this landscape comes a tool that's gained some serious traction for assessing these emotional symptoms,
Hmm.
the depression, anxiety, stress scales. You probably know it as the DASS-21.
Yeah, many people have likely encountered it.
Exactly. Maybe you've even filled one out. So today, we're not just glancing at it. We're doing a real deep dive into a systematic review that, well, it put the DASS-21 under an incredibly powerful microscope, really examine how well it measures what it says it does.
Yeah, that's right.
Our mission for you, the listener, is to cut through all the jargon, understand how robust this widely used tool truly is, and maybe uncover some surprising nuggets of knowledge,
Well,
things that'll make you genuinely well-informed about mental health assessment.
that's a perfect framing. And what's really fascinating about the DASS-21, I think, isn't just that it's widely used, but why. It's relatively short, it's pretty easy to administer, and critically, it's free.
Ah, that's a big one. Free.
It is.
Hmm?
And that combination has led to it being used across incredibly diverse populations, translated into, I think, 44 different languages globally now.
Wow.
But, with that kind of widespread use, questions naturally pop up. Is it reliable? Is it valid? Does it consistently measure what it intends to?
Sure. Makes sense.
So our source material, the systematic review from Quality of Life Research, used the updated Cosmin methodology, which is really rigorous.
Cosmin. What's that exactly?
Think of Cosmin as like a super strict detective for evaluating these kinds of patient-reported outcome measures. It's kind of the gold standard. So this wasn't just a casual look. It was an in-depth investigation into 48 studies, all trying to understand precisely what the DASS-21 measures and, importantly, how well it does it. We'll explore its strengths, which are considerable, but also point out, where more research is needed, give you that comprehensive, nuanced understanding.
Right. So before we get to the heavy lifting of the review's findings, maybe step back for a second. What exactly is the DASS-21? Where did it come from? What makes it, well, special?
Good question. The DASS-21 is actually a shorter, more concise version of an earlier scale, the DASS-42.
Okay.
It was initially developed with a specific goal: measure the negative emotional symptoms of depression and anxiety. But here's a really interesting detail from its development.
Oh,
Yeah, during the research, a third distinct factor kind of empirically emerged from the data. It wasn't just depression or anxiety. It was related to feelings of irritability, tension, agitation.
something different.
Exactly. The researchers realized this was unique, and they labeled it stress. So the DASS-21 assesses these three distinct, though related, emotional symptoms: depression, anxiety, and stress.
Got it. DASS.
Precisely. And the motivation for this big systematic review, well, was partly to address concerns about inconsistent results in past studies about its measurement properties. Some studies said one thing, others another.
Right. Clear up the confusion.
Exactly. By applying this updated Cosmin methodology, the researchers aimed to provide a clear, evidence-based summary. They evaluated each study's quality and then synthesized all that evidence into a coherent picture.
And you mentioned systematic review, 48 studies. That sounds incredibly thorough. How extensive was this investigation, really? What kind of scope are we talking about?
Oh, it was very thorough. They pulled together 48 distinct studies, which came from 41 different published articles, gathered meticulously from major medical databases: Medline, Embase, CINA-HL, the big ones.
Okay.
And the scope was genuinely global and diverse. These studies included a whole spectrum of people: healthy individuals, patients with chronic physical diseases, and crucially, people with diagnosed psychiatric disorders.
So not just one type of person.
Not at all. Spanning numerous countries, using many of the translated versions of the DASS-21. And it's worth noting, the review focused on its use in individuals over 14 years old.
Right.
And that Cosmin methodology we talked about, it's just crucial here because it sets such a high standard for evaluating these kinds of tools. It's like a strict auditor, checking the quality of the original studies, the consistency of results, the overall precision.
Okay, so we understand the tool, the DASS-21 itself, and the rigorous way it was examined. Let's get to the exciting part. What did this review find that the DASS-21 does really well? Where does it genuinely shine?
Okay, yeah. One of its strongest areas, and this was maybe a bit surprising in its strength, is its bifactor structural validity. It receives sufficient high-quality evidence here.
Bifactor structural validity. Okay,
Yeah.
break that down for us.
Right, and this is where it gets really interesting, a real nugget. Many earlier studies tried to fit the DASS-21 into a simple three-factor model in depression, anxiety, stress, three separate boxes.
Yeah, that seems intuitive.
It does, but the bifactor model tells a more complex and actually more useful story. It suggests the items on the DASS-21 load onto two kinds of factors simultaneously. There's a broad, general, negative emotional state factor.
Like an overall distress level.
Exactly, like a master volume knob for just general emotional distress. And they also load onto the specific depression, anxiety, and stress subscales. Those are like independent fine-tuning dials for each specific symptom.
Huh. So you get both the big picture and the details.
Precisely. It means the DASS-21 can give you info on someone's general negative emotional status and distinct insights into each specific symptom. One study, for instance, found this general factor explained 62% of the item variance. That's a lot. It highlights how important that overall distress measure is.
Wow, okay. That's actually really powerful for one short tool. To give you the forest and the trees, kind of.
That's a great way to put it. It's quite rare for such a concise instrument to offer both that broad stroke and the fine-tuned understanding so effectively.
So that's about its structure. What about consistency? If someone takes it today, and assuming their state hasn't drastically changed, takes it again soon, would the results be similar?
Right, that takes us to internal consistency. And good news here, too, it also demonstrated sufficient high-quality evidence, specifically under that bifactor structure we just discussed.
Okay.
This basically means the individual items within each scale and the scale overall, they hang together really well. They're consistently measuring the same underlying thing.
How do they measure that?
They use a statistic called Cronbach's alpha. And for the total scale, the alphas were impressive, ranging from 0.90 to 0.95. It's very high.
And for the specific scales, depression, anxiety, stress?
Also very strong. Depression was between 0.82 and 0.92, anxiety 0.74 to 0.88, and stress 0.76 to 0.90. Generally, anything above 0.7 or 0.8 is considered good to excellent, so these numbers show strong internal consistency.
Yeah.
The items are reliably tapping into those constructs.
That's reassuring. So it's consistent within itself. But the million-dollar question for any tool like this, does it actually measure what it claims to measure? Especially compared to other established trusted tests. That's construct validity, right?
Exactly, construct validity. And here again, the review found sufficient high-quality evidence for hypothesis testing of construct validity.
Meaning
The DASS-21 subscales correlate strongly with other well-established measures for similar things, just like you'd expect or hypothesize they would.
Can you give an example?
Sure. The DASS-21 depression scale showed high correlations with the Beck Depression Inventory, that's a very common one, with an average correlation coefficient R of 0.73. And with the H-ADS depression scale, another respected tool, it was 0.69.
Okay, so they tend to agree.
They do. Similarly, the DASS-21 anxiety scale correlated highly with the Beck Anxiety Inventory, averaging 0.75. So it suggests that when the DASS-21 indicates depression or anxiety, other well-regarded tools are likely picking up on the same thing.
That's good.
And the review also found strong evidence for what's called known groups validity. This means it can effectively tell the difference between groups we'd expect to differ, like people with a psychiatric diagnosis versus those without. That's crucial for any assessment tool.
Makes sense. And how does it fare against, say, the gold standard, like a clinician's expert diagnosis?
Ah, yes, criterion validity. Here we saw really significant strength, but with a nuance. The DASS-21 depression subscale showed sufficient high-quality evidence when compared directly to a psychiatrist using a structured clinical interview for DSM diagnoses, the SCID.
The SCID, that's like the detailed clinical interview, right?
Exactly, often considered the benchmark. And the performance of the DASS-21 depression scale was impressive. They use a measure called area under the curve, or AUC. The AUCs range from 0.77 to 0.91.
Is that good?
Very good. And AUC tells you how well a test distinguishes between groups here, those with and without clinical depression. Values closer to 1.0 mean better diagnostic ability. So the numbers are strong. It suggests the DASS-21 depression scale aligns well with a clinical diagnosis.
Okay, but you mentioned a nuance.
Yes. Importantly, the anxiety subscale didn't reach that SAM high standard in this specific comparison against the SCID. It only showed insufficient, moderate quality evidence for criterion validity. So strong for depression, less definitive for anxiety against that particular gold standard.
Interesting distinction. Okay, so the DASS-21 clearly has some serious proven strengths. It's concise, widely used, free, and performs robustly in several key measurement areas. But as you said, no tool is perfect. Where did the review find room for improvement? or areas where things are maybe less clear?
Right. This is crucial for a balanced view. Let's start with content validity. Now, overall, the DASS-21 showed sufficient moderate quality evidence here, and even high quality evidence for its comprehensiveness, meaning it seems to cover the key concept.
Okay, that sounds good.
But there was only very low quality evidence for its relevance.
Relevance. How is that different from comprehensiveness?
It's a subtle but vital distinction. Comprehensiveness asks, does it cover the important topics? Relevance asks, are the specific questions, the response options, the time frame like cast week, actually relevant and meaningful to people taking the test in their specific situation?
Ah, I see. So have patients and experts really weighed in on whether the questions feel right?
Exactly. And the evidence for that specific kind of validation, directly involving patient and expert feedback on the items themselves, was rated very low quality. It's a foundational aspect. If the questions don't resonate, the answers might not capture the full picture. So more studies focusing on that relevance aspect are strongly recommended.
That makes a lot of sense. What about consistency over time? We talked about internal consistency, how the items hang together, but what about if someone takes it, say, a month apart? Retest reliability.
Good point. For reliability, specifically that test-retest aspect, the evidence was found to be insufficient and of low quality across all three subscales: depression, anxiety, and stress.
Oh, really? Why is that?
A big part of it was methodological issues in the studies they reviewed. Often, the time gap between the tests was either too short or, more commonly, too long. Remember, the DASS-21 measures emotional states how you feel now or recently.
Right, which can change day to day.
Exactly. They fluctuate. It's not measuring a stable personality trait. So capturing that traditional test-retest reliability is genuinely tricky. You need the right time interval.
So the reported numbers weren't great.
Well, some studies did report correlations. Pearson's are in ranges like 0.75 to 0.78 for depression, 0.64 to 0.73 for anxiety, 0.64 to 0.65 for stress. But because of the methodological concerns and inconsistencies across studies, the overall rating remained low quality. This area definitely needs more rigorous assessment, using timeframes appropriate for fluctuating emotional states.
Okay, so reliability over time is a bit murky. What about its ability to detect change? If someone gets therapy, does the DASS-21 score reliably show if they're getting better? That's responsiveness, isn't it?
Yes, responsiveness. And here the picture is, well, quite mixed. For the depression and stress subscales, the review found sufficient low-quality evidence.
Low quality again.
Yes, but for the anxiety subscale, it was even lower, insufficient, and of very low quality. A key problem, again, was often methodological. Many studies use statistical tests, like paired sig tests, that aren't really ideal for assessing responsiveness properly. They might show a change is statistically significant, but not necessarily if it's clinically meaningful.
So the math showed a difference, but maybe not a real-world difference.
Potentially, yes. Or at least those methods aren't the best way to demonstrate it. We also saw some inconsistent results that complicate things, like depression scores generally went down in psychiatric patients after treatment, which makes sense.
Right.
But in one study of traumatic brain injury patients going home, their depression scores actually increased. Now, that might reflect real new challenges they faced, not a flaw in the tool.
True, context matters hugely.
Absolutely. But it highlights that judging responsiveness needs careful methodology and consideration of the context. So using the DASS-21 to confidently track progress over time, that still needs more solid validation.
It really sounds like how you measure is just as critical as what you measure, especially with something as dynamic as emotion.
Couldn't agree more. And one final area needing attention is measurement invariance.
Invariance, meaning?
Meaning, does the tool work the same way across different groups? For example, does it measure depression or anxiety consistently in men versus women, or across different cultural groups or languages?
Oh, okay.
Yeah.
That seems really important for fairness.
It's vital. For the older three-factor structure, the evidence for invariance across gender was rated as inconsistent moderate quality. So sometimes it seemed to work the same, sometimes not. But for the bifactor structure, the one we said seems optimal based on validity evidence.
Right.
Well, measurement invariance couldn't even be assessed. There just weren't enough studies looking at it from that bifactor perspective. This is a major gap. Future research absolutely needs to check if that bifactor structure holds up consistently across groups like gender, age, culture, language. Otherwise, comparisons might not be fair or accurate.
Wow, okay. So we've covered some really impressive strengths, but also some significant areas where the evidence is weaker or just missing. Bringing it all together for the listener, what does this mean? What's the big takeaway about the DASS-21's place in the mental health toolkit?
Well, I think the main message is that the DASS-21, despite needing further work in certain areas, really did demonstrate robust psychometric quality in several key domains. That bifactor structural validity, internal consistency, construct validity, and especially the criterion validity for the depression subscale, these all receive sufficient high-quality evidence.
Which puts it on par with other big names.
Exactly. When you evaluate it using this rigorous Cosmin methodology, it really stands shoulder to shoulder with other well-known respected measures like the CESD or the HADS in terms of its core psychometric robustness. It's fundamentally a solid tool in many ways.
That's a pretty strong endorsement for its basic function, then.
I think so. And its strengths also include its wide applicability. It's been validated in healthy folks, psychiatric patients, people with chronic physical illnesses, and importantly for people over 14, it gives you that useful dual perspective, the overall negative emotional state picture and specific insights into depression, anxiety, and stress. That's a real plus.
But you flagged some important practical limitations, things someone using it or encountering it should know.
Yes, definitely. While it's great for assessing symptoms, a key practical limitation right now is the lack of widely established cutoff points.
Meaning scores that clearly indicate mild, moderate, or severe.
Precisely. Unlike some other tools, like the HADS, which has generally accepted thresholds, the DASS-21 doesn't currently have those universally agreed upon diagnostic or severity cutoffs. This limits its use as, say, a quick screening tool where you need a clear signal about clinical significance.
Okay.
Also, using it as an outcome measure to track change over time with confidence, like seeing if therapy is working, that still requires more solid validation regarding its responsiveness, as we discussed.
Yeah.
And, it's worth repeating, for kids under 14, we need more research before applying it reliably.
And the interpretation.
The review really emphasizes interpreting both the specific subscale scores and the total score, keeping in mind both the distinct symptoms and that overall negative emotional state captured by the bifactor model. It's not just one or the other.
So there you have it, a really comprehensive look at the DASS-21. It seems like a remarkably useful, accessible, free tool. Huge advantages there, especially strong for measuring overall negative feelings and specifically depression symptoms. But like any powerful instrument, understanding its nuances, knowing where it shines and where more research is needed, that's absolutely crucial for using it responsibly and interpreting results effectively.
Absolutely. And this kind of deep dive, I think, really shows the rigorous journey involved in validating these psychological tools. It's so much more than just writing some questions down. It's about deeply understanding what those questions truly measure and how well. And maybe it leaves us, and you listening, with a provocative thought.
Go on.
How does digging into this level of methodical, systematic review change your perception of self-report measures in mental health? Does knowing about things like bifactor models or content validity relevance make you think differently? And maybe more importantly, how might knowing these kinds of details empower you to critically evaluate the information or the assessment tools you encounter, ensuring they're genuinely fit for purpose when trying to understand something as complex, as nuanced, and as vital as human emotion?